Hey guys, it's Dr. Hobbins from Hobbins Medical Direct Primary Care. We're doing a video today about the importance of the adult annual physical and covering what do we actually do at the adult annual physical. So for a good number of years now, I've based all of the kind of boxes that I check at an annual physical off of the recommendations of the United States Preventive Service Task Force, otherwise known as the USPSTF. So this is a body that puts out guidelines on what are the important things to screen for and why. And so it helps keep us up to date on things that we should be looking for from a preventive medicine standpoint. So the physical exam, there's a lot of things that are important to do, and I'm going to highlight the most important things. So the first aspect of a good annual physical is having your blood pressure taken, and this occurs as one of the almost first steps of the visit in many cases. So for patients who might have a high reading at the initial screening, I will oftentimes retake the blood pressure later on in the visit once the patient's had a time to sit and rest and maybe get into the conversation of the visit a little bit and make sure that they've had a chance to settle. But the recommendation for proper taking of blood pressure is to be seated with your arm at heart level, supported, and your feet supported on the floor. And you should also actually grab 5 minutes of rest beforehand. Most people who are monitoring their blood pressure at home, they don't sit and rest for 5 minutes before. And so just know that that's kind of the way it's intended to be taken. It's not always the way that it is taken, but when it comes down to really finding out is high blood pressure a concern, that's the way you want to do it. Why do we screen for high blood pressure? Well, we know that people, you might have heard high blood pressure referred to as a silent killer. So most often there's no symptoms at all, and by the time symptoms of high blood pressure arise, it's already really high. But we know that blood pressure that's even too high out of range can begin to cause issues with the heart, with the brain, with the kidneys, and so forth. So we do worry about risk of heart disease like congestive heart failure, heart attacks, strokes. High blood pressure is a risk factor for all of those things. Vision changes, damage to the small blood vessels in the eye and kidneys. So high blood pressure is always the first box that I check because there's usually no symptoms when it's too high. It's very easy to do, it's very common, and it's something that we can treat easily through a variety of ways, whether it's changing certain aspects of your lifestyle, what you're eating, how you're exercising and that, or using medication to lower the numbers into a safe range. Okay, the next topic that I usually address during a complete physical is screening for diabetes. So screening for diabetes, the United States Preventive Service Task Force, the USPSTF, they recommend screening all adults over the age of 40 for diabetes. And we will actually do it sooner than that if you have risk factors for diabetes, like being overweight or a strong family history. So I kind of lump all this together into lab work. We can check your blood sugar using a glucometer. We could check it in the office, but a lot of times we just order it as part of your routine blood work, where we'll tend to check your blood cells, your liver, kidneys, and electrolytes, and blood sugar, and then cholesterol. So that's kind of the next important screening parameter is being screened for high cholesterol. Also, generally no symptoms unless it's extremely high, and also a big contributor to heart disease and strokes. And so these are, heart disease is the #1 killer of both men and women. So we want to go after and seek out, am I at risk? And maybe I don't even know it. So oftentimes at a complete physical, we'll order appropriate lab work. There are other tests that pertain to different age groups and different risk factors in that, but screening for diabetes and screening for high cholesterol are always high on the list. Next would be cancer screening. So in men, there are recommendations to screen for colon cancer beginning at age 50, and there's a movement for that age to possibly be lowered. Screening for prostate cancer in men over age 40, and screening for lung cancer in smokers over age 55. In women, we screen for breast cancer. There are a variety of recommendations on when and how that should be done. I tend to favor performing mammography at 40 years of age for an average risk woman, but again, family history and other factors can influence doing that earlier or later, and also how exactly we screen. There are other techniques besides mammography, like breast exam and also breast MRI. In women, we also will review the need for cervical cancer screening, so pap smears, and that too can vary widely depending on age and risk factor groups, but that's an important cancer screening for women. So in men, again, it's lung, colon, and prostate. In women, it's breast, cervical cancer, lung cancer, also for smokers, and breast, colon, cervical, and lung. Okay, so cancer screening. So we'll go through that for everyone. And then next I review vaccines. So tetanus vaccine, generally recommended every 10 years. It has the booster. If you get the correct tetanus vaccine, it will have the booster for whooping cough, which can be important so that you don't become a carrier of pertussis. So if you are a grandparent who is going to be hanging around newborn grandchildren, it's important to have that booster because it will actually reduce the carrier state of pertussis, which can easily be transmitted to newborn babies. It also will protect you if you get cuts and scrapes. We review annual flu vaccines, patients who are candidates for pneumonia vaccines, shingles vaccine, and then also the COVID-19 vaccine, which we're trying to follow closely. So that's an important part of what we do at preventive exams. Screening for depression is done at all physical exams. Again, this is something that's very common and people don't always talk about it. And it can be easy to diagnose depression and or anxiety in someone who is outwardly complaining of those things, but sometimes it's more subtle than that. And sometimes depression may show up as a physical complaint like headaches or insomnia or appetite changes. And so that's something that we try to screen for, knowing that it's very common, and we can help with that too. Lastly, the performance of a thorough physical exam is something that we do. Certainly this is an area that can be rushed, and I think it's really important to take a lot of time, do a head-to-toe examination, check the ears, the eyes, nose, mouth, throat, neck, the thyroid gland, listen to the heart, listen to the lungs, examine the abdomen, look at the skin, look at the feet and toes, and check the sensation, and do all of these different things. And very often something that you thought was just normal, it may actually be a problem that needs attention. And then on the other side of things, a good physical exam, you can maybe gain some reassurance, like I guess everything is going well here. My heart sounds good to my doctor, the lungs are good, my abdomen's okay. So it's an important thing to do. So these are some of the highlights of things that we do. There are evidence-based guidelines on what to do at a complete physical each year, but most importantly, we look to discover patients who are at risk for heart disease, who may have diabetes, patients who may be struggling with common conditions like anxiety or depression, high cholesterol. So we try to make these very high yield experiences. The other thing that is really super important about doing your annual physical is it gives you and your doctor a chance to discuss what your health goals are, and it gives your doctor a chance to know you when you're well, so that if you present to your physician when you're sick, they know what the differences are. They know what your baseline is, and they can see where you are when you present sick. It builds rapport. It gives you the opportunity to ask questions. It really, to me, is kind of the catalyst of everything that will happen in your healthcare throughout the year. So I encourage all patients to get an annual physical. When you're a baby and a child, you get more checkups than you can count. You lose track of all of them, and as an adult, it's easy to put it off. But it is the first step towards good health in so many ways. So I encourage all patients to get their annual physical. We covered some of the most common things that are addressed at your yearly physical. Oftentimes you can get into other subject areas that are of interest to you, or your doctor may identify that you're at risk for other conditions that you need to be screened for, and it's the best way to stay ahead of your health and take a preventive approach so that you're able to enjoy good health. So again, I hope you enjoyed the video. If you have any questions, you can leave them in the comments section below. If there's any topics that you would like us to cover in the future, again, leave them in the comments below. If you're interested in learning more about direct primary care, please visit our webpage. It's www.hobbinsmedical.com, and we'll see you next time. Thank you.